Hey, I'm Quincy and I'm a radio personality, but just like you, I'm always wanting to make better health choices for myself and of course for my family. Now that's why I've teamed up with my friend Dr. Dean Tyndall and the fine folks of New Life Naturopathic, the creators of new-lifeweightloss.com, to bring you a podcast focused on giving you the information you need to make the best health decisions for you and your family. Now, that's going to be without sway from what mainstream medicine has become. Now, this podcast, Pursuit of New Life, we're going to release one each Friday. And we're going to focus on debunking the mainstream medicine myths now associated with naturopathic, holistic medicine, while giving you clear insight into ways you can make your health a lifestyle and not a jump from fad diet to fad diet. Experts in the fields of biochemistry, chiropractic, physiology, women's health, and much more will weigh in on a range of topics, all designed to open your eyes, expand your knowledge, and bring you to new life. Now be sure to subscribe to Pursuit of New Life on all the podcast platforms, and also follow us on YouTube at newlifenaturopathic.com, and be joining us every Friday for Pursuit of New Life. Thanks for joining us for Pursuit of New Life. We would love for you to subscribe on YouTube, New Life Naturopathic, and share that with your friends, as well as, of course, on your preferred podcast platform. Let people know great information from a holistic point of view and the original medicine, as Dr. Tyndall calls it. We're going to get into a very important topic today, and we're going to jump right in because it is very, very important because it gets misdiagnosed a lot. Thyroid, New Life team. We're going to talk about that today, and it's a very important part of our function and everything that happens in our body. Dr. Tyndall has that awesome Harrowers chart there to help us, and we've got a few graphics for those that are watching on YouTube, just to show the complexity of this thing and how it gets misdiagnosed, it gets mistested, it gets taken out, all kinds of crazy stuff. But if you go to the natural holistic medicine folks, you get a lot better understanding of thyroid. So we're going to talk about that today. Dr. Tyndall, get us started as always.
Hey, Quincy. Thanks, guys. One of the most fairly common things that we see in our office is we get a lot of people coming in with a thyroid problem. I get a lot of people that message me, hey, Dr. Tyndall, I think I have a thyroid problem. I said, so what should I do? And I said, the first thing we need to do to find out is you actually have a thyroid problem.
Right.
And they kind of get confused a little bit, and they're like, well, my doctor ran my TSH and my T4, and my TSH is high, which means the numbers are high, which means I have hypothyroidism. I know it gets confusing with some people, but the higher the number goes up, that's hypothyroidism, because I tell patients the TSH is a parent and the thyroid's the kid. So the louder it gets, it's trying to get the kid to do its job.
Yeah.
And if it goes way low, the number goes under like 0.9, you start to get into hyperthyroidism. That means the thyroid's running too fast. So your numbers going down, the stimulating hormone's going down because you're trying to slow down that thyroid from going. The problem is that it's a lot more complicated than that. When we do our testing, and Miriam's going to kind of touch on that here pretty soon, what tests we run. When we do that testing, we take those tests, we look at the different ratios, and I'm going to kind of go into that a little bit more in depth. So that what we're trying to figure out is it's a hypothalamus problem, pituitary problem, thyroid problem, adrenal problem, liver problem, dietary problem, GI problem. And like I said, we'll kind of get into a little bit more the meats and potatoes of that here in a little bit.
Yeah, and I know there's a lot of statistics involved in why this is such a problem and misdiagnosed and all of those things. And Dr. Stuber, I know you're going to take a stab at the numbers today.
Yes, sir, I am. Thyroid disease or hypothyroid disease is very common, and it's 10 times more common in women than it is in men.
Interesting.
Interestingly enough, the numbers show that thyroid disease in women affects about 12% of women. And the average age that women are diagnosed, this really surprised me, is 25 years old.
Wow.
So when you look at those numbers over time, the age at with women are diagnosed is getting earlier and earlier and earlier. And your thyroid is critical for all of your body function. It's like the idle in the car. It controls how fast or how slow everything moves. And they estimate about 60% of people that have thyroid problems don't even know they have them. And part of the problem with that is medical doctors don't run the right tests to know where the problem's at. As Dr. Tyndall was talking about, women have a complex organ system, or hormones are complicated, and they're all connected. So when one goes up, one goes down. It has to be balanced in order for that idol to work right. And you need to find somebody that knows what they're doing. You have to run all those labs in order to see where the problem is.
Mm-hmm.
A lot of people will present with, oh, I'm losing weight, or I'm gaining weight, or this, could I have a thyroid problem? And we have to test it. Well, I don't know without testing it. The other interesting thing is that 60% of people diagnosed with thyroid problem, it's actually simple as an iodine deficiency.
Wow.
And that really, really shocks me because it's so simple. And a lot of people, they've cut salt out of their diet, and it's the primary source of iodine in our culture because people just don't eat that. They should, but they don't eat that many products that have enough iodine in them.
Mm-hmm. So this comes back to something we've talked about before, and I know Miriam's getting ready to get into this. Medical doctors and mainstream medicine aren't testing correctly for these issues.
No, they do a basic thyroid screen, which it's about 4 things. And it has to do with just the surface of the chemicals that relate directly to the thyroid.
Mm-hmm.
And as Dr. Tyndall says, they'll palpate, oh my goodness, you have a little nodule there. We just need to take that out. They don't, so many tests come back inconclusive. And personally, I always tell patients, hey, if you didn't see the path report yourself, I wouldn't do anything.
Right.
If you don't, I just see doctors lie. And I say that freely because
they want to cut.
They just don't know. They're just like, well, I know, I'm just going to lie to get what I want, or to get the patient out of here. Wow. So, and your thyroid is so important. Another thing I always point out is chiropractic. Your thyroid is hooked onto your spine. So you can have neck problems that irritate structurally the thyroid or affect the nerves to the thyroid. So a lot of patients, it becomes as simple as we give them an iodine supplement and they get their neck adjusted, and voila, things get better. So so many times things are so much simpler than what we think. And I do want to bring up the cost of the medical institution because I went through this myself. I wanted to compare. I wanted to see how much a medical doctor charges for the thyroid panel, which is 4 basic tests, nothing else, just the little hormones of the thyroid. And I got my bill back. It was $1,800. And it gives me goosebumps because I was in shock. I was thinking, oh, it'll be $800, which is ridiculous enough. So I went to Dr. Tyndall. I said, how much is this panel here? $15. So,
come on.
Well, it wasn't that cheap. It was,
I couldn't make this stuff up if I tried. I mean, it's unbelievable.
What was that, Dr. Tyndall?
Yeah. I think when we do we don't do a basic thyroid test. So when we do our full panel, and Miriam's going to cover it, it costs $170 or something like that,
compared to the $1,400 on the basic thing. Wow. Well, we've been teasing it now for a little while. So Miriam, what makes the testing that you guys get to do, what makes naturopathic the right way to go when it comes to checking out this thyroid issue? Give us some of the down low on this.
Yeah. So just as Dr. Stuber was saying, the great thing about us is we partner with Evexia currently, and we'll be partnering with a couple more really good lab testing companies. But the great thing about what we provide is a comprehensive patient report, and it's super super nice. It's very visual, easy to read, color coded, where you can basically see all of your ranges. So the testing currently that we provide for thyroid is free TSH. TSH stands for thyroid peroxidase antibodies. And this is a great way to test your thyroid levels. So free TSH, free T3. The T stands for triiodothyronine, and that's also included in one of the comprehensive labs. We also include free T4, total T3, total T4, TPO, and actually I apologize. So TPO stands for thyroid peroxidase antibodies. TSH is the hormones for the test. So we also provide thyroid antibody, reverse T3, and then T3 uptake. And so these are all great tests that are all included, and most of them are kind of all included in one comprehensive test or package, but you can also test for them separately as well. But the costs are, I mean, just like Dr. Stuber just mentioned, I mean, the costs are close to none, and that's with or without insurance. But you could probably get away with paying some of it, or get your insurance to cover the cost of some or all of it, depending on your insurance. So that's another great thing, is we work with insurance with lab testing. So that's currently what we provide, and we can give you more details depending on your specific condition, and what tests would be best for you. And that's all on our website as well.
newlifenaturopathic.com. And I know that for people that are not there in Elizabethtown, Kentucky, and they're watching this or listening to this thinking, well, I can go to the website. How does that mean I get to get tested too? Is there a way for people that are not there, that are not local, that can still take advantage of the opportunity to work with you guys and work with these tests to get their understanding and find out what's going on?
Yep, absolutely. At-home test kits. That's the great thing about modern testing right now these days, telehealth, and being able to, excuse me, order a test online, get it, in the mail, do whatever swab you need to do, and just send it back. It is that quick and easy. TSH is probably the most common, or thyroid, thyroid stimulating hormone. That's probably the number one test that we provide for most thyroid issues. But yeah, I mean, you can, we provide services to 47 states currently. The 3 other states that we can't currently, but hopefully in the future, are New York, New Jersey, and Rhode Island. But everyone else is in the clear for that. Lots of politics that we won't mention here.
Right. It always comes back to that, doesn't it?
Always.
But it sounds like to me, though, for people that are dealing with this, or have been tested, or have gone through the process, naturopathic approaches this better, just like pretty much everything we've discussed on this podcast. So for people that are maybe thinking, okay, how do I know if it's a thyroid issue, or how do I know if I even need to ask for these specific tests? Dr. Tyndall, what kind of things can they be looking for in themselves to know that maybe this is a road they have to go down?
I think we have a graphic here that's you can pop up there. It's kind of common signs of you have an underactive thyroid. We do see hyperthyroidism, but not very often, because usually those are medical emergencies in a lot of cases, so they're handled differently. but you'll have unexpected weight gain, and you tend to gain weight everywhere in your body. Like you just kind of puff up.
So not just the normal stomach getting bigger because I ate too much.
Yeah, you kind of gain weight everywhere because it's you're basically your metabolism starting to shut down and slows down, and you're not burning energy, so your body's storing that energy, so it stores it everywhere in your body. Constant fatigue and tiredness, again, lack of energy, because it's that thyroid, as Julie said earlier, it's kind of your accelerator, kind of speeds up or speeds up or slows us down. Muscle pain, menstrual cycles, menstrual problems, dry hair or dry skin, flaky skin, elevated cholesterol will start to go up, poor memory, concentration. Sometimes you'll have heart palpitations, cold hands, cold feet. Sometimes you can look in a mirror, you can actually see swelling in your thyroid. So there's lots of stuff. So what we do is how we kind of go about assessing a patient is first thing we do is assess a patient. So we do their intake paperwork, we do a consultation, we go over their history, we get a ton of information from them. So, because what we're trying to do is narrow it down to what kind of problems are they having. As Mary mentioned, we have kind of a comprehensive health panel. We call it the New Life panel. It's a panel we put together specifically. So we're looking at your sugar levels on that. We're looking at, because one of the insert is, and also as Julie said earlier, one of the things we're hormonal, so we can get out of balance. And one of the big hormones that really throws our system out of whack is elevated insulin. And that's because of diet. So what we try to do is a panel that we're kind of looking at your whole health. And then when we look at these labs, there's another kind of graphic, if you want to throw it up there, so when we look at the labs that we're getting, what we're doing is you can see that it's a kind of complicated process, because you got your hypothalamus that releases a hormone called the thyroid releasing hormone to the pituitary. The pituitary releases thyroid stimulating hormone to the thyroid. The thyroid then, if it has all the nutrients and it's functioning properly, will create T3 and T4. About 7% of that is T3, which is active hormone that runs your metabolism, turns things on. The other 93% is inactive, and it has to be converted. And usually, most of it's done, that conversion is done in the liver through phase 2 detoxification. So if you're not having the nutrients that you can support phase 1 and phase 2 detoxification, or you're missing selenium in your diet, you can't do conversion of T4 to T3. Also, some of your other tissues, your kidneys and other areas will convert your hormone. Also back into your gut, you have to have a healthy gut flora. So people who are on antibiotics and things like that can mess up your thyroid also. On here, it doesn't show it, but if you'll see a thing where it says RT3, that's your reverse T3. 20% of its T4 is converted to the inactive form of what they call reverse T3. That's for stress. So for what our body has a natural response for stress. So for short-term stress, we don't want to burn excess energy, say, for example, if we're fasting or we haven't eaten for a couple of days, or just under a tremendous amount of stress, our body will make more reverse T3, which is inactive. So it shuts down it's another way to shut down our metabolism and preserve energy.
Mm-hmm.
So if we end up with people under chronic stress, which, wait a minute, most Americans are.
Well,
So
even when you start talking about some of this stuff, when we start talking about, well, it could be your thyroid, it could be your liver, it could be this, that not just if you didn't have stress before that.
Yeah. So, and I'm, again, sometimes people think that we bust on MDs, and we're really not. Most of them are good people. The problem that you have is education. Right. They're just not educated this way. They're educated to look at everything as a drug therapy, instead of looking at what's wrong. And how we look at people is and it's kind of fascinating, because how do we get all this physiology and all this information? Well, when they produce a drug, they have to release studies on how physiology works. And then what we do is when we get a hold of the stuff and we go, how do we use nutrition to put into this system, this physiological system, to repair the system and not have to have a drug.
Right. And something as complicated as we just looked at, and even on this, if you're watching on YouTube, New Life Naturopathic, you can see the complicated nature of what we're dealing with just the thyroid. That's not the rest of the Harrower's chart that you've been seeing kind of behind Dr. Tyndall there that we've showed in other episodes. It's this complicated, but when you go to a medical doctor, which again, as you talked about earlier, when they're in their lane doing what they're supposed to be doing, if we could find a way for naturopathy and medical doctors to work together, that'd be something. But since it doesn't happen that way, yeah. So we've got this complicated thing that you guys need to do these tests for, and people need to know this information, which is why we're doing this podcast.
Yeah. So in the other tests that we have to do, like she mentioned, like, for example, like the T3 uptake actually doesn't have anything to do with T3. What it has to do is if that number's off, then that can indicate we have an iodine deficiency or selenium deficiency. So you have to supplement with that. So what we're trying to do is figure out what the problem is and what we're doing with the labs. And it takes a lot of training. I think I'm working on a card right now. I think there's 17 different scenarios for what. So if my TSH is up, my T4 is up. For example, like say if your TSH is up, okay, and your T4 is elevated, but your T3 is low, that's indicative of a liver problem because you're not doing the conversion. So what you have to do is you have to go back and you go, okay, if my T3 is low, did my pituitary do its job? Well, it did, because the pituitary kicked up and the TSH went up. Okay. And then you look down the line and you say, did my thyroid do its job? Well, yes, it did, because it made T4, because my T4 levels were within normal ranges. So why is my blood circulating T3 low? Well, it's because my liver is not doing the conversion. Okay. You can have an elevated TSH. I'm sorry. You can have an elevated TSH.
I was going to say, I like how Dr. Stuber pointed out earlier. She said it's like the idle in your car, which normally we get the car reference from Dr. Tyndall too when he simplifies things. But I keep going back to that in my head. That's an important thing there that regulates some things.
Yeah. So you're basically, what you're doing is you're looking at all these organ systems and how their hormones and how they're affecting the production of T3 and T4 and maintenance of those numbers in your bloodstream. So the liver has a huge impact on it. The adrenals have a huge impact on it. Your pancreas, by producing out insulin, has a huge impact on it. The hypothalamus, the pituitary, and the thyroid itself. So you have to kind of, if you don't know how to read the labs and go through it and even pick the right labs.
Yeah. Well, I'm in the middle of a series with Karen Lacefield, who's part of the New Life team as well. On Return to New Life, we're talking about the liver. And she talked recently in one of our episodes about the liver and the gallbladder and how they work together. But the first thing a surgeon or a doctor wants to do is they either want to take out the gallbladder if there's a problem, or like we're talking about now, if you've got a hint of a thyroid problem, they want to just take it out. So that's the one big difference that I've noticed in talking to you guys and some of the other circles that I get to be in because of this podcast is you want to treat to where your body gets to use the stuff that's there that God created it to do. And doctors want to say, let's cut it out. Yeah. Let's change it because you were designed dumb. Let's give it a pill or let's cut it out. And I think that, we're talking today to try to hopefully help people understand that there are other options than a ton of pills and a surgery.
Yes.
Yeah.
Go ahead, Dr. Stuber.
One thing that I think it's important for people to know is once you take thyroid medicine, it's very difficult, nearly impossible to ever get off of it because your body stops. Your thyroid just shuts off. And it's dangerous. If you have a thyroid problem and it goes undiagnosed, it will kill you. I mean, it really, really will make you sick. So it's something to pay attention to because it will shut your whole body down. Or if it's going fast, you'll just get real thin, and it really makes you very, very sick. So I encourage people, before they blindly go and say, "Oh, well, I need to take Synthroid or levothyroxine," you better make sure that the diagnosis is correct and you've had everything checked properly, because it is a sentence. It's not like insulin or something you have to take that, well, I'm going to eat healthier, I'm going to do the right things, I won't have to take that anymore. No, thyroid is something that once you're on the medicine, it is difficult, if not impossible, to ever get off.
Dr. Tyndall, do you want to add to that?
Well, yeah, it's difficult. Not completely impossible, but it takes a lot of work, because the problem with any hormone that you take in, I call it exogenous, external hormone that you take in, you have feedback mechanisms. Again, if you look at those charts. And so once you put those external hormones in the gland that makes the hormone, goes, I don't have to work. And the feedback mechanisms kind of shut down, because, I got plenty of thyroid hormone. So my hypothalamus, my pituitary, they kind of like, and the thyroid itself, it still produces the hormones, but it gets messed up because it's what actually does it, because you're actually given synthetic T4. And so the thyroid goes, I don't have to make any hormones. So it goes kind of offline. And so it takes a lot of work to get them straightened back out. And again, the other problem is, like, I had a patient out of Tennessee. She had her thyroid taken out because she had nodules, which is, when you see nodules on the thyroid, it's considered T4 toxicity. You have too much T4 floating around the system, okay? And they create nodules. And so when they do the biopsy, probably 9 times out of 10, the biopsy comes back as inconclusive. But the patient's scared because they hear the C word, cancer. And so what they do is they cut it out. Well, this lady had hers, and they put her on the highest dose of T4 they could, or Synthroid they could, and she spent 3 years in bed, basically.
Wow.
She felt terrible. She got a hold of us. Yeah, she got a hold of us, and we assessed her, and guess what? It was her liver. So we put her on liver products and changed her diet, got her nutrition that supports her liver, got supplements that supported her liver, especially phase 2 detoxification. And guess what happened? Boom. She's out of bed. She's running life good, and she's working, and she's gotten her life back. And unfortunately, since she's had her thyroid out, she has to stay on the Synthroid for the rest of her life. But guess what? She now knows, her main problem was probably originally the liver in the first place. And, but now we got her life back. So she's working and doing those things.
Yeah. Well, the big thing that we're doing is getting the information out there. We're encouraging people to, obviously, we want to see you come to the New Life Naturopathic website and see if the New Life team can help you, but letting you know that there are options outside of what mainstream wants to tell you. There's options outside of going under the knife. This holistic approach, this natural, original medicine is really what you should be searching out and doing this research to. At newlifenaturopathic.com, reach out to the team and see what they can do to help you. I know thyroid is a very complicated issue, as we've shown. Is there anything else we want to make sure that people know today before we wrap up this episode on the thyroid?
Well, if you want a more in depth, I think I have a video on the YouTube channel that I did about a couple years ago. Kind of really goes through the numbers.
Okay.
Here's a key thing is, and this is what I tell people, and Julie and I were talking about this the other day, Occam's razor. And what you want to sometimes do is you start with the simple stuff first. If that fixes it, then guess what? Hey, I'm doing good. If it doesn't fix it, then you can go to the more radical things of cut your thyroid out and getting on medications for the rest of your life. The more radical shouldn't be your first choice. The first choice should be, hey, I need to change my dietary habits. I need to probably have someone to assess my thyroid properly, try some nutrition, try this first. And then if that doesn't work, then let's go the more radical routes.
Yeah. Well, and we would love for you to reach out to us. You can email at contactnewlifenaturopathic@gmail.com. We're going to probably be doing a question and answer episode again soon. But just anytime that you have any questions related to anything that we get a chance to discuss, you can go to contactnewlifenaturopathic@gmail.com. Well, friends, another deep subject covered. And obviously we can't cover it all here, but this is scratching the surface and getting people thinking about this issue. And again, this is one of those things, almost every time we come up with a topic, I'm thinking, man, I've heard it this way so long. I've heard it wrong so long that I'm glad that we're getting this information out there. So the thyroid, a very important episode. So folks, if you listen to this and think, oh, well, my friend thinks that their thyroid is messed up, send them this episode. Make sure that they're hearing this information about the testing that's available to make sure before they make a decision on something drastic, as you were just talking about, Dr. Tyndall, because it tends to happen in the medical profession to go to the drastic first. And we want to make sure we're avoiding that. Well, for Dr. Stuber and for Miriam, who had to leave us a little bit early this episode, and for Dr. Tyndall, we thank you for joining us. We encourage you to subscribe and share with your friends at New Life Naturopathic on YouTube, and also, of course, on all the podcast platforms. Pursuit of New Life. We'll see you next time.
Thanks, Chris.
See?